Hello and welcome to the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. We've got 3 special guests today. We're talking to Dr. Cindy Tran, Dr. Denise Tyson, and Dr. Karen Jackson-Williams. They're from the Advanced Integrative Health Group, and today we're talking about acupuncture. Welcome, ladies.
Thank you.
So we're going to start off talking about how acupuncture actually works. And we'll start off with you, Dr. Tran. How does acupuncture, how does it work?
It's based on this basic idea that our body is a ball of energy, and it's organized in different pathways called channels and meridians. And when we have pain or any type of symptom, those channels and pathways get blocked. And what we do is we use needles, and there are certain energy points that those meridians and channels exit and enter, and we stick needles in them, and they clear up those channels and have the energy move smoothly again.
Well, I'm going to ask one of the most frequently asked questions about acupuncture. Does it hurt?
Yes and no. The needle that we use is just, the diameter is like a piece of hair. So it's very, very thin. So when you think of a hypodermic needle, because people think of needles as a hypodermic needle, it's not even close. You can fit 20 acupuncture needles into the head of a hypodermic needle. So you can imagine it's like a piece of hair touching you. However, the sensation from the needle entering your body triggers a response. It's almost like an electrical response, and that's usually what people are feeling. After that goes away, usually patients report that there's no feeling with it.
I've seen, Dr. Jackson-Williams, over the last couple of years that more mainstream medical organizations are moving toward acupuncture. Why is that?
Proven. It's proven results. And people are really getting frustrated with their current health system that isn't providing results, and just really giving them a bunch of medicine, opioids, and it's not taking away or getting to the root of the problem, the root of the disease. It's just putting a Band-Aid on it. And so therefore, because people are asking for something other than Western medicine, then the healthcare system, our leaders, they have to respond. And so therefore, we're becoming more mainstream because people are talking about it, talking about the results. I went to an acupuncturist, I had this, that, and the other, and it really helped. So it's working.
Do you believe in combining both traditional medicine and the acupuncture? For example, if you've got some sort of cancer, do you believe combining whatever treatment that your Western medicine person recommends, be it chemotherapy, with the acupuncture? Or do you suggest the acupuncture alone? How does that work?
Well, no, I wouldn't suggest just acupuncture alone. I think that that's in our name is integrative health for that reason, because our goal is to collaborate with Western medical practitioners so that we can get whole health for the patient. And frankly, in some instances, you do have to go to the Western medicine treatment. If you have cancer and you need chemotherapy, your body, if you look at Chinese medicine, a lot of it is preventive, okay? And we intervene with a treatment. But if your body is so far gone that your cells have changed to the point in which we're unable to intervene, then yes, we have to get chemotherapy. But we can also help with the chemotherapy. We can help it with the healing process, and we also can help with the symptoms, because chemotherapy has symptoms. So it's widely used in hospitals today, acupuncture, to combat the symptoms of the chemotherapy and other drugs or medication that the patient is taking.
Such as nausea.
As nausea,
yeah. Nausea and weakness.
Women's issues can you take it? Because as you all know, a woman's body is unique. We've got different issues than men. So how does your group address that? Women's issues as far as things like menopause, as far as things like dealing with problems with the uterus, and just different issues that women have to deal with.
Well, with women, it's great because we're able to really treat a number of issues, menstrual cramping, PMS.
And what I meant to say is fibroids.
Fibroids. Oh, okay. Oh, you want to get to that?
Yes.
Oh, yeah.
I meant to say things like fibroids, which you all have to know. It is almost at epidemic levels when it comes to African American women.
It is. It is.
So, yes, we help with a myriad of women issues. And basically what we do is we do an intake and find out what is the cause. And generally, or most likely, it's a hormonal imbalance, cramps. It could be diet related as well. So we treat our patient holistically. It's not just, we're going to stick a needle in you. We're going to partner with this. So we might have to look at your diet and, make suggestions that you need to take this out, for example, because if you have fibroids, then we know that caffeine, or you should know that caffeine is something that you should not be ingesting because that just makes it grow. And so we'll have a conversation about that. And it is a partnership. So hopefully you will take our recommendation, we'll stick the needles in you, you'll feel better, and you have to do your part. You might have to sleep. A lot of people push themselves through life and they don't take the time to cultivate that quiet place. Like, yoga. We might recommend that you need to take yoga or some form of moving meditation, or one that you just sit still. But it's more than just coming in, getting a needle, and then leaving and you're fine. So, yeah, we're going to partner with our patients in their wellness.
All our patients get homework.
Yes.
Yes. And to add on to what Dr. Karen was saying, it's a lifestyle that we look at, the background, how the person feels on an emotional level.
Yes.
A lot of the times fibroids, tumors, any type of growth in our body is because of the fact that emotionally we're not expressing ourselves, we're stressed out. And so what acupuncture does is we also deal with our patients on an emotional level and helping them clear that out, and that translate into the physical form and hopefully clearing out the fibroids or tumors or stuff like that.
What do you say to people who are skeptics when it comes to things like acupuncture, things that are not your traditional Western medical treatments?
I tell them to come right on in.
Come in.
I love working with skeptics. It's not about believing. It's medicine that works.
That's right.
Whether you believe
don't
or
have
not.
to believe.
Right. There's acupuncture for animals. They don't have the consciousness to think and believe like we do, but it also works for them as well.
Interesting.
Yes.
Let's talk about pain management. We've got a lot of people who are in pain for a variety of reasons. And if they don't manage their pain well, as we've seen, a lot of people are becoming addicted to pain medications. So let's talk about that for a minute. How does acupuncture help when it comes to managing pain?
Well, acupuncture works, when it's inserted, you're triggering a number of systems, one of them being your neurological system. And most of pain is interpreted from your central nervous system, from your brain. And acupuncture is really great at being able to trigger a response in your own endorphins, your body's natural pain relievers, to come to the surface and deal with your pain. And right now, we have the American College of Physicians who's endorsed acupuncture because they're saying that your first course of treatment should be some of the other modalities, and that would be acupuncture, the yoga, the massage therapy, physical therapy, before you turn to a drug or opioid, which in turn could be addictive. If the person is on opiates and becomes addicted, we're also there too, because we're all certified acupuncture detoxification specialists.
So what exactly does that mean? Acupuncture detoxification specialist.
So that means that we are able to assist people who are addicted to a number of substances. And that too goes through the central nervous system, as Dr. Tyson was saying. So when we're treating someone that is addicted, there's a protocol. It's NADA that we utilize, and it's the National Acupuncture Detoxification Technique that is used. There are 5 needles that are put in the ear. So utilizing auricular acupuncture to stimulate a response using these 5 needles that will address this sympathetic nervous system, which has a way of calming down the nervous system. That flight or fight response.
Fight.
Yeah, fight or flight response. The problem is that we're always in this hypervigilant state of fight, right? And we don't even know it. And so we're trying to calm that down. And that's why we'll go to some sort of drug or cigarettes or whatever it is that gives us the ability to take a deep breath. And the ability to take a deep breath is what brings us back to ourselves and has the ability to calm down our nervous system. And then people are able to find relief and get off of substances. When we first initially started out in school, our first needling was done at a drug center in Baltimore. And we were able to help many people. These people were oftentimes mandated by the court system to get this treatment or either go to jail. And many people were delivered from their addictions as a result of being forced.
So you put the 5 needles in the ear.
Yes.
And then what happens?
Then you sit and you just relax. Perhaps there's some meditative music that is on. You just remain quiet.
But what does it do? Does it stop you from having the urge?
The urge.
The cravings.
Yes.
Each point has their own specific functions.
Right.
One point is, like Dr. Karen says, it works on the sympathetic system. One point focuses on your kidneys and clearing out your kidneys and detoxing the kidneys. One point focuses on the lungs, encourages you to breathe.
Yes.
The liver, filters blood. Mm-hmm. The heart, making decisions, following your instincts, and following our body's natural instincts for detoxing and de-stressing, rather than relying on drugs or any type of substance to de-stress ourselves.
How many treatments do you need? Does it work the first time, or do you need to come back 3 or 4 times, or does this need to be a lifetime thing?
Well, often the patients we were seeing in the clinic, they were there every day to get the treatment. And it works best if you have treatments in succession. We also can apply a more semi-permanent type needle to the ear, in which that would stay there and when you go home.
Stay stimulated.
Stay stimulated. You can stimulate it yourself with your finger, or it would just stay in place. And some people get it's almost like a small earring to put into the points. And what it does is subside the cravings. You won't crave it anymore. I mean, I have patients I treat even for smoking cigarettes, and they say, oh, the cigarette doesn't taste the same. I didn't enjoy it. It just changes your whole body's perception of the drug and the need for it.
And it depends on the individual. Some people can use one treatment and be delivered, if you will. Stop smoking, for example. I heard someone tell me that they received one treatment and they no longer wanted to smoke and had been smoking for years. So it depends. It just depends on the individual.
And so you said that there are 5 steps?
5 needles.
5 needles.
5 points.
But there are steps that go along with it, and you name them all. You said the heart and the liver and all of that stuff. What have you seen? What are some of the results that you've seen? You said it's been successful. Do you have any personal stories of what success have you seen? A person came in and they were in this state, and after a couple of days or after the first day they left and they were cured.
And so one patient I can think of in the addiction center where we were working, she came in, and before we could even start, she says, I just want to tell you also, I want to thank you, because she was addicted to crack, which is a very serious addiction, very hard to treat. And she had been coming, and she said that her mom had just passed. She'd been taking care of her mom had just passed, and she said that was a situation in which I would have gone to get more drugs. And she said, I had no desire. I had no desire at all. And she was just crying because she said she just never thought she would get to a place where she was not going out to buy drugs. She had no feeling for it. She just stopped. And and crack is a very serious addiction.
It is
too.
a very
hard to
serious
treat.
addiction. Like we were just talking about this whole opioid thing. In the state of Maryland, it's at epidemic proportion.
Yes.
People are dying.
People are dying. It's serious.
And you guys you can help them live again.
Absolutely.
Yes. Oh, yes.
Within a couple of treatments.
Yes. Absolutely.
So is it, because we've talked about women's issues, we've talked about opioid, is it, so it's not, it can't possibly be one treatment for everything. But in a way, explain that.
Well, if you were to come in with a particular ailment and you get your first treatment, you will find some relief. You may not have 100% relief, but you will get relief. And you will feel a change. So usually for our first treatments, a lot of times we have a protocol. We might use just basic detoxification, just to clear the palate. Even from that alone, patients will say, wow, I feel great. And we may not have even gotten to the main treatment yet.
Yes.
Right.
Yeah,
Wow.
we're just clearing the slate.
A lot of the times, that's all a patient needs, is to just clear out their body, just to kind of press the restart button, and that's all they need to really feel great again.
You know what's also interesting about what you guys do now? Most people don't know that it's covered now to some degree by insurance companies.
It is.
Because people start thinking, oh, I got to come out of my pocket. How much is it going to cost? How many treatments do I need? I can't. If they immediately, the brain shuts down and says, I can't afford this. Explain now how insurance companies are more receptive to this type of treatment.
Yeah, the insurance companies are receptive. Our practice, and all of us are credentialed with the major insurers and even Medicaid. So we're able to process their insurance. We do it in-house. Some practitioners may give the patient what's called a super bill with all the charges that they turn in themselves. But in our practice, we actually process it for them. And so usually they have to pay a copay, as they would at any medical practitioner. And it's great because most times patients can come as much as they want. Some insurers have a limit on the number of visits, but a lot of them don't. And they can come in, children too, have pediatric patients as well.
I try to educate my patients in terms of the benefits, and proof is a great teacher, right? Evidence. So when people are feeling better, then they value the service that's provided to them. I really would like people to be more proactive in taking care of themselves, because this is ancient, proven medicine. And Western medicine is actually very new in comparison to this traditional medicine. And if people value their wellness, and that comes through educating, we do a lot of educating in our practice. If people are educated about the benefits of receiving whatever it is that they need to live well, to be better in themselves, then make the investment. So instead of buying, this Gucci bag or your new hair weave or, getting your hair done or whatever, the new car, invest in yourself. Because I remember, all of this discussion about healthcare and, what's provided and what's not going to be provided. I was one of those people that was helped by Obamacare. Because for years, working for myself, I didn't have insurance. And so I had to do what I needed to do. And when I was starting out, I saw the value in receiving acupuncture, not for physical trauma. It wasn't because I had pain physically, I had pain mentally. I mean, I was stressed out. I was trying to survive. And acupuncture afforded me the ability to live well in myself, to come into, have more patience, to be grounded, if you will, because life is always going to have whirlwinds that come against you. And so how do we stand in the winds of change? It was important enough for me to take my money, and I didn't have any, if you will, looking from the inside. Somebody could say, you're using that to do that? It was worth it. It kept me sane. It kept me grounded. And people come into the office, and I like to say, they come in with a ticket, piggybacking on Dr. Denise, saying that in response to the other question, people come in for a particular reason, and there's an unlayering that takes place. So your ticket in the door might be, my knee aches, right? And as Dr. Cindy said, the knee ache could very well not be because of I fell on my knee. It could be because I've worried too much. I worry mentally. I have affected, or emotionally, this has an effect on my body. And the only time we get to see or understand what's going on is, unfortunately, when there's some sort of pain that we can categorize, if you will. My hip hurts, but that was not the start of it. Your hip hurts because you emotionally has some upset. And so we get to the root of it, and we encourage our patients to become very active or engaged in their well-being.
I am very much into mindfulness, knowing your body. And I've said this time and time again. The only time we feel our bodies is when we're having sex and when we're having pain.
That's true.
Those are the only two times when you really feel your body. You need to feel your body all the time.
All the time.
So that you know when something's wrong.
That's right.
Before the doctor does.
Yeah, it tells you.
And that's going into what you were talking about with that mental health, that mental piece is so very important.
It is very,
Very, very important.
It is.
So you guys deal with things such as depression and stress.
Oh, absolutely.
All the time, yes. We have many patients who come to us, and the root is their emotional state,
Right.
and they're depressed, and that's why also we're all certified mental health aides.
So that's what I was getting ready to ask. That was my next question. So how do you deal with, because it takes more if you've got mental health issues than just the acupuncture. You've got to deal with whatever emotional issues are going on, and you're not psychologists.
Right.
So how do you deal with it?
So for the actual appointment with a patient, there's a point where we actually talk to the patient. So we gather information about the patient, and we actually sit down and go over it. So in listening to the patient, we're able to pick up a lot of cues and a lot of information about the mental state of the patient, just in conversation. So I may not have to ask you directly, are you depressed? Are you sad? I'm going to get that from what you're saying. I'm going to ask into what you're telling me. And there I'm going to be able to determine, we're trained in that, to determine, where you are. Now, we're not therapists. It's like a mental health therapist where we're going to do talk therapy. But we can work very well with a mental health therapist.
Absolutely.
And many times I've had patients referred to me from a mental health therapist, because they say, I'm able to get further with the patient after they have treatment with you.
Right.
Yeah, I had one therapist, he was just referring patients because I want to see you first before they come back to me, because we open the door.
Yes.
We're able to, with the needles and the acupuncture, we're able to calm your system, and we're not threatening, because they don't see us that way. They don't see us as a psychologist who's coming in to solve the puzzle.
Now, we've got 5 minutes left in this program. We're going to do a second program, part 2 of this, where we're going to talk about the Chinese medicine, and we're going to talk a little bit about Reiki. But I don't want to leave this program without letting everybody know you guys are kind of unique. You've got a women's practice.
Yes.
Tell us, so what brought all of you together, because there are 4 of you.
Yes.
What brought all 4 of you together?
Well, we were all enrolled in the doctoral program at Maryland University of Integrative Health, and we were thinking, well, we're going to be finishing soon, and we really need to make an impact. And I have a background in health administration and have worked 30 years in healthcare and very familiar with...
You didn't say 3, you said 30.
30. 30 years, yeah. Working, you know, that was my life. And really working on the business and finance end of healthcare. So I'm very familiar about, you know, the business structures and what works with physician practices and everything. So I was anxious to really come out and have a model for acupuncturists that would fit well into the way we're already structured in healthcare, make more of an impact with the public. And my classmates here, they were willing to go on the road in the venture.
We're going to have to wrap it up for this portion of the program. But you guys have a practice, and we'll put all of this at the end of the credits. Your practice is in Gambrels.
In Gambrels, in the Anne Arundel Medical Center Wall Chapel building.
Yeah, and like I said, we'll give the website and your phone number and all that information at the end of the program. But I would like to thank Dr. Cindy Tran, Dr. Denise Tyson, and we've got Dr. Karen Jackson-Williams. You've been watching the Sisters for Fitness Wellness Show. I'm Stephanie Gaines-Bryant. Have a great day.